Hello and welcome to Askimo TV. I'm talking today to Dr. Krishna Moorthy. Dr. Moorthy is a specialist in bariatric and upper gastrointestinal surgery. Hi, Dr. Moorthy. How are you?
Good morning, John.
Dr. Moorthy, let's talk today about obesity surgery treatments. So why is obesity a growing concern? And what are some of the devastating problems obesity can lead to?
It is a fact, Joanne, that there is an obesity epidemic, especially in the Western world. The incidence of obesity in the United Kingdom and maybe even in the United States is that about 30% of the population can be considered to be obese. The problem with obesity, obviously, is it impacts on one's health. More importantly, obesity is linked to conditions such as type 2 diabetes, high blood pressure, obstructive sleep apnea, and all of these together and separately can cause severe conditions such as heart attacks and strokes. And that is the reason why there needs to be urgent and concerted attempt to treat obesity across the world.
What are some of the signs and symptoms that may indicate that someone should seek the help of a physician? Like how is obesity measured?
So obesity is measured by what's known as body mass index, which is BMI, which in a very simple way is the weight in kilograms divided by the square of the height in meters. And once BMI is 35, or if it's definitely more than 40, then I think people should start seeking some advice for the management of their obesity. Patients who have type 2 diabetes, high blood pressure, obstructive sleep apnea, patients who have these and are obese should definitely seek the advice of their doctors or their physicians and try and do something about that, because their risk of dying from heart disease or strokes is significantly higher if they have any of these conditions and are what's known as morbidly obese, which is a BMI of more than 35.
Tell me about some of the various surgical treatments available for obesity.
There are various procedures that are done across the world, but the three most commonly performed procedures are laparoscopic adjustable gastric baths, laparoscopic sleeve gastrectomy, and laparoscopic gastric bypass. All these procedures are done by keyhole surgery by expert surgeons in expert centers. A laparoscopic adjustable gastric band, in a very simple way, is the placement of a soft silicone band on the top of the stomach. When that band is filled up with fluid, that band constricts the stomach and divides the stomach into two parts, a small pouch on the top and the rest of the stomach. When that pouch fills up with food, and it obviously fills up with food very quickly because it is a very small pouch, patients experience fullness and they have to stop eating. A sleeve gastrectomy works by a similar principle. A sleeve gastrectomy is a procedure that involves removing 70% to 80% of the stomach and leaving the stomach as a very narrow tube. And when that tube, which is actually very small, fills up with food, patients feel full and they have to stop eating. So both a band and a sleeve are commonly called restrictive operations because they restrict how much a patient can eat. The gastric bypass is slightly more complex. In a gastric bypass, we surgeons divide the stomach into two parts, a small pouch on the top, and we leave the rest of the stomach behind. And then we take a loop of bowel or intestine and we join it to the small pouch on the top. So the gastric bypass works via two ways. There is a restrictive element because the stomach is now a very small pouch. And because of the bowel being pulled up and joined to the small pouch, this bowel, which is approximately a meter long, does not do any absorption and digestion. And for that reason, it's also called malabsorptive. And that's how the gastric bypass works.
What do you feel that people should consider before making a decision on any obesity surgery treatment?
One of the most difficult things for patients when they have made a decision that they want to seek surgical treatment for obesity is which procedure to choose. Because the reality is that as a surgeon, I wouldn't be performing any of these procedures if I did not believe that they're effective procedures. So all these procedures are highly effective. It's just a question of patients deciding which procedure is best for them. And in my practice, it essentially boils down to how much weight do patients want to lose, because the weight loss varies by about 5 to 10% with all these operations. How quickly do they want to lose it? Some patients don't want to lose it very quickly, and some patients want to lose it fairly rapidly. The other decision factors are the presence of diabetes and how bad the diabetes is, the presence of heart diseases, kidney diseases. So all these might decide which procedure is safer for which patient. And the last but most important thing for patients is how much of risk they're prepared to accept. Some patients, because they realize they will become a lot healthier, want to lose as much weight as possible, and thus are prepared to take more risks, and they would go for something like a gastric bypass. But there are some patients who just cannot stand the idea of even a very low complication rate of, say, infection and leakage and bleeding, and they will probably choose a gastric band. And the decision making is a tricky bit for patients because all these procedures are very effective in achieving their aims.
Thank you, Dr. Moorthy. Thank you so much for talking to me today.
It's a pleasure, Joanne.